Alright, so this is the second video for my gender-based medicine assignment. I couldn't combine both videos. So the first one was a little mini skit, and this one is going to talk about more about gender-based medicine. For that scenario, the intended audience was definitely towards x-ray technicians. That does happen quite often in the radiology department, where we have female patients that come in and identify themselves as male. That poses a risk for us because in school we're taught radiation safety and protection. We need to know what tissue we're x-raying through. We have certain questions to ask, like pregnancy and things like that. So that's why it's super important to know the difference between your biological sex and your gender. Since we're on that topic, sex is the biological makeup of what you are, so like your reproductive organs and things like that, while gender is more social behavior, characteristics, what you believe, who you think you are, your identity, things like that. People quite often think they're one and the same, but they're definitely different. And that's why it's really important to know the difference, especially when it comes to healthcare and medicine. Okay, so backtracking to scenarios. When the male patient comes into the x-ray department, we need an x-ray, but they are female. How do we approach that? You know, what to ask? You know, are we okay to ask, is there any chance of pregnancy? You know, we don't want to hurt their feelings or cross any lines and things like that. So setting policies and procedures for your company is super important, as well as education, you know, having seminars, presentations, online modules, things like that. And I even think like learning certain terminology is super important because speaking to transgender patients, you don't want to discriminate or anything like that or make them feel uncomfortable. This is all their experience, and you just want to add value to that and just improve on that patient care. Moving on to a different scenario that happens quite often as well. You have John coming in for shortness of breath through the ER. He sits in the lobby. It's not a urgent need to bring them back. So they finally bring him back, they get him a room, doctor comes in, evaluates, orders a chest x-ray and some blood work. The patient's sitting there with shortness of breath increasing. Well, John is actually Sally, legally. And they do blood work. John's blood work comes back, troponins are super high. So they decide to do an EKG. The EKG shows ST elevations. That is a heart attack. So that is grounds for calling in the STEMI team right away because John's having a heart attack. Well, statistically, women only have shortness of breath as a symptom for heart attacks. Had everyone do their protocols and, you know, looking at the patient's chart, knowing the difference between sex and gender, they could have bypassed the time, because when it comes to heart attacks, time is of the essence for sure. They would have gotten the patient back right away, done an EKG first, and, you know, get the ball rolling. As opposed to a male patient coming in complaining of chest pain, you know, they would have brought that patient back right away, things like that. So that's why it's super important for healthcare workers to know the difference between gender and sex, because not only does it pose a risk for us, but we are risking the patients for sure. So yeah, that's why. Other than that, that concludes the second portion of this video. So hopefully you enjoyed both, and thank you for watching.